Mogadishu is one of the fastest growing cities in the Horn of Africa and is making strong progress in terms of social infrastructure, such as security, business, education, and other aspects of community development. After the central government of Somalia completely collapsed. Government agencies have all left the country, and most of the non-governmental organization too. However, there are very few international organizations that took a strong decision of remaining with disparate displaced community for their basic humanitarian services and survival. SOS Children Village Somalia that was in service for Somalia community from 1985 to date. SOS Hospital was major facility that has on forefront in serving the Somalia during the devastating period of civil war that has lasted for that 2 decades.
It was after collapse of Somalia that SOS services was felt by all. Upon the collapse of Somalia state was the only NGO that was offering mother and child health care services. It was only place where our nation survived.
The SOS organization started working in the country in the beginning of 1985. Its mandate is to provide care for abandoned children or children who do not have parental care or are at risk of losing it. 10 years after the collapse of the Somalia's central government, another need emerged as a result of the civil war and that provision of qualified healthcare professionals.
The demand was we could not find many qualified and competent nurses and midwives to work in the hospital. Same for other health service providers. In May 2002 is when we established SOS Community Nursing School.
Actually, the college has been training professional nurses and midwives, even when during challenging security landscapes marked by incidents where some of the dedicated staff of the college, including the founder and students, lost their lives and many of team got injured while actively in the pursuit of teaching and learning duties. The college operates in a conducive and optimal learning environment that encompass physical infrastructure, with well-maintained and ventilated classrooms, libraries, schools, labs, and computer labs, and other facilities that facilitate teaching and learning. There are buses available to bring the trainees or student from their homes to college by 8 a.m. for the 5 working days. Training schedules goes on for 8 hours daily with practical session throughout in order to produce highly skilled and qualified nurses. SOS took an extra initiatives for taking the trainees for real practical sessions in major hospitals in Somalia, including Banaadir, which is Mother and Child Public Hospital in Somalia. Kisani and SOS Hospital was a permanent facilities for trainees to carry out their practical sessions regularly.
The hospital consists of 7 departments. Normally the hospital serves the mother and child hospital. The principal objectives of the hospital is to save the health of mothers and children across South Central Somalia. The relationship between SOS Mother and Child Hospital and the SOS Nursing College, I can simply say they teach theoretically and we train practically.
معهدك caafimaadka ee SOS runtii xiriir soo jireen ah oo taariikhi ah naga dhaxeeyo markii loo fiiriyo xarumaha kale oo caafimaadka ah.
The SOS Nursing College has a historic relationship with us. Compared to other health centres in this town, our relationship has started since 2003 when they first approached us for collaboration. This was when their foreigners know as sisters visited us during their assessment as part of other hospitals in town. They then selected our hospital to be the most suitable to do the practices after they considered many factors. They then started to send us first group for practices since 2003 to date after they found us that it is Kisani Hospital that can match their requirement.
ayuu noo bilowday ayagoo group markaa kadib 2002 groupkii ugu horeeyay ay soo bilaabeen ilaa hadda oo maanta 20 guuridoodii ay tahay.
waxyaabaha faa'iidada ama xusuusaha goobnida oo aan la iloobi karin waxaa ka mid ah
The benefits, and what is to be remembered and is unforgettable, is that we learned an SOS institution for free, and no amount of money have ever paid. Also, the curriculum that was prepared for us was a different one, with high standard compared to other used in the country. We were also arranged into rotational, with specious time to enable students learn in different part of hospital, while sufficient week were organized for us.
Apart from the trainees committing most of time on mother and child section of the hospital, they also take time some in general health services during their internship period in hospitals.
The students who are from SOS school, nursing, they have a very good contribution in our hospital. They have a very good key positionists as well as head trainees. They work as our supervisors, head nurses, and in-charge nurses.
Since it was founded, the college has trained more than 600 health professionals who are currently holding a higher position in the country's health system.
SOS Community Nursing College standard benchmarked training programs, both pre-service and in-service trainings. For pre-service trainings, we offer training to nurses, midwives, community health workers, and community nutritionists. Additionally, we also offer in-service trainings for the practicing health professionals, where we offer over 50 training packages for the practicing health professionals. And more interestingly, our academic and management staff, including me, the principal, are the proud graduates of this school. And that really gives us more energy and responsibility to train and impart the knowledge that we attained from the same school.
Mission of improving the standard and quality of health education in the country, the SOS took great initiatives of establishing a standard curriculum in collaboration with Ministry of Health Somalia. It was just recent on 6th of March 2024 that the launching meeting of the established National Health Education has been conducted, where all stakeholders has been invited to participate.
It's a great pleasure for me that I witnessed the launching ceremony of this great curriculum of bachelor degree in nursing. I see for all those who participated or contributed to this, led by SOS Children's Village, Somalia. Thank you so much. As I speak on its behalf, I also appreciate Somali Ministry of Health, because it has devoted a lot of time, mind and resource for the success of this.
The production and success has not just came on a silver plate, but was as a result of sacrifices that was made by some of prominent people, including Sister Leonela Scorbati, was lost her life, the course of serving the mission to complete for nursing college.
The situation of the country was very, very, very critical. There is a lot of war, there is a lot of fighting, there is a lot of fire, there is a lot of pumping. Sometimes, some of the days, the roads were blocked by militias. I have been working as a nursing school for 15 years, and I have a lot of experiences. And I live within the community. The community has a great respect from SOS Nursing School.
Hay'adda SOS hawsha aad haysaan oo runtii bulshadu ay aad uga faa'iideysatay inaad sii horumarisaan hawshana loo qabto si sugnaan.
SOS organization keep on delivering the humanitarian action doing for the community and do it with consistency, and everyone should take his responsibility, and in case of any mistake or weakness, the management should be supported so that they manage it well to make the management benefit from the services provided. This should be done with unto other. But taking responsibility for his own benefit and welfare as part of his obligation.
The SOS organization has implemented health centers at IPD camps outside Mogadishu city to provide basic healthcare and nutrition services to internally displaced people who cannot reach or get an access to hospital in the city. The role is well played by SOS health staff with support from trainees at our nursing college. Sophia is one of the trainees who currently pursuing her practicals at a IDP camp.
I'm a student at SOS Nursing College and we talking our weekly practicals here. If the patient comes first, we measure his weight, height and appearance. We also register their details, take pictures.
For 22 years in service now, SOS Nursing School has produced members of health professionals.
And the students that we have trained since 2002 are up to today working in both public and private hospitals across the country, gap filling all the existing staffing gaps that existed in the country. It's a very good pleasure for us as an organization that we have been able to contribute in the rebuilding of Somalia's health workforce.
Actually, we have a various collaboration with the SOS nursing schools and the Ministry of Health. Also, SOS alumni, they contribute more in the health system in the country, like improving and enhancing the health system in the country.
This documentary production has given us great opportunity to meet with many people who have graduated from SOS Nursing College and furthered their education level up to university degrees. Most of those who are currently working in major health organization and hospitals.
I grew up in SOS Children's Village, Somalia, where I started my life from SOS up to the university level. I started my education level from kindergarten up to university level. I joined this college as SOS community nurse in 2006 when I finished in my secondary school.
Day by day, the number of students who want to join the SOS Nursing College has been increasing. Despite of the limited number of students who can be admitted every academic year into the programs offered by the college, this has resulted to the college management to plan a step forward in improving the capacity, scope and quality of the college programs in order to increase the overall beneficiaries of the program.
We plan to expand our presence in the country. We hope to establish satellite colleges in different sectors of the country, different regions of the country. For example, Baidoa, Kismayo, and eventually to be able to reach the entire provinces in the country. We also plan to expand the range of courses that we have in the country so that, there are gaps in many different areas as far as the skilled health workforce is concerned. So we have to expand our program so that we are able to provide a variety of skills to our graduates. We also plan to upgrade the college. We have learned quite a lot over the last, since 2002. So we plan to scale up our training to university level education. We have been providing college level, but now we plan to convert this to university. We have initiated the processes. We have already worked on the curriculum, and we are also planning to increase the range of infrastructure and the facilities available to our graduates.
waana ku faraxsannahay SOS inay soo saartay dad badan oo dalka wax ka taray.
We Happy SOS produced several prominent people who contributed a lot to development of this country. The state government will always be there to encourage SOS Nursing School and its student, and we expect them to carry out their duties as per Constitution and declare our close partnership with school.
annagana waxaan leenahay iskuulka saaxiib dhow ah.
Somalia. Now transforming positively at high speed in terms of politics, economy and socially, it's a great opportunity for SOS Nursing School to make vibrant development, which already started the journey of upgrading the college into university level and soliciting for more partnership and participating in collaborative health development ecosystem.